It's basically, or what they call, a practical aesthetic approach. We all know that skin graft, STSD is the gold standard for any burn patient. Common donor sites including thighs, buttock, back, which heals with a visible scar and also heals slowly. But what if these donor sites are excess burnt? So that is when we look at a valuable and underused donor, which is scalp, which is highly vascular. There's rapid healing, and then there's a large area, and hair growth hides the scar. The literature tells that rapid depletion because of the abundant hair follicles and these stem cells around the hair follicles helps in rapid reapplication, and there's large surface area and multiple harvests are possible. And there are no complications including alopecia and scarring. Aim of our series was to establish scalp as the valuable donor site, and then objectives being describing scalp harvesting technique, reporting graft take, how the donor has healed, and then the complications which happens at the donor sites, and how aesthetically the patient has come back after once the wound has healed, and highlighting practical advantage and challenges. We took 10 burn patients requiring skin, and then selection was based on graft size needs, like how much is required, and based on that we harvested from the scalp how much we have to harvest, and then based on other areas of availability and patient preferences in aesthetically requiring patients. We use a common dilution formula of bindable ringer lactate and 1:1000 adrenaline as a tumescent, and we use an electrodermatome for harvesting, and then we meshed, and then donor site was covered with collagen. Outcomes, what we noticed in these patients was how the graft uptake has happened, and then how long did it take for the the donor site to heal, complications, and the patient satisfaction. Surgical technique. So basically we first mark the hairline of the patient before starting any procedure, prepare the scar, and then subhealing infiltration we did. We use electric dermatome for thin consistent skin grafting, and then we meshed and applied to the burn wounds. Donor site management, how we did was basically we applied collagen over the donor sites after achieving hemostasis, and healing was noticed in 7 to 10 days. This is a summary of our 10 cases. The average age being 3 to 40 and 6 were males and 4 were females. Total burn surface area was around 20 to 60, and graft size required was 300 to 500, which it can give is 300 to 500 square centimeter. Graft uptake, thankfully it was more than 90 in all the patients, and then donor site healed within 7 to 9 days. Complication rate is nil to 20 in most of the cases. In our cases, two of the patients had little complication, and then the patient was satisfied with our patient based on Likert scale. And some of the patients whose donor sites are themselves burnt in our patients which we chose, and then we harvested from the scalp. You can see 4 different patients in which we have taken, and then this is after achieving hemostasis. We have applied collagen, and this is post-op day 3 after achieving applying collagen, because post-op day 3 there is no collagen collection or there is no infection locally can be noticed. And then this is a patient. You can see in the lateral views, you can slightly notice there is that we can get to know that there is we have taken graft from there, and in the front it is barely visible that patient has been taken graft from the scalp. And this patient, actually, this is post-op day 20. The collagen fell off after maybe 7 to 10 days, and then the hair started growing. So the minute hair you can see. And then we measured using measure 1:3. And then the graft uptake results were good. And this is a patient who has come back after 1.5 years. The first patient coming after 1 year and the second patient coming after 1.5 years. The scalp is beautifully healed with the growth, and there is no externally. Aesthetically, patient is pleased with it. And then complications, there's no hypertrophy scarring of alopecia. Even if it happens, we know how to deal with it. There's a high patient satisfaction. And then the literature says folliculitis can happen 1 to 7%, but thankfully we didn't have any folliculitis in our patients. Generally, in any other donor sites, what we notice is the pain and the bleeding. In this patients also, 7 patients were good, but 2 patients noticed mild pain, and one of the patients had postoperative bleeding also. So the advantage of scalp being a donor is the scar is concealed and the healing is revealed in the patient. There's rapid revitalization, good color match for patient burns, multiple harvests possible, and minimal morbidity can be noted in these patients. Challenges, bleeding risk can be there, and so tumescent and hemostatic technique we can use. And need for shaving is a minor issue. Patient, if he's having anxiety, just counsel the patient and show the previous images, healed images, so he'll be at least be happy that he'll not have such complications. Correlation, results aligns with the published studies. There's faster healing than ionocytes. Lower complication in our center was noticed than the reported averages. So concluding, Scalp is a reliable, reusable, cosmetically favorable donor. There's rapid healing and minimal scarring, effective with high satisfaction and low complications. So basically, what are the implications? We have to start considering Scalp as a primary donor site rather than not looking at it. We have to set protocols for repeated harvest. We need a larger comparative trials for multi-centric districts, because it was only one center which we have done, and I tried looking out for many other cases in India if they've done, but I couldn't find any. So we should start considering Scalp as a primary donor site. Thank you, and this is our team, and that's my comments.
Manjuna, good results.
Thank you.
Usually, Scalp thing you use for pediatric products, you extended to adults also.
Yes, sir.
Good results. Any questions? No questions.
Well, Dr. Manjuna, you have shown good result with this Scalp. What percentage of graft you can take from this Scalp?
So, based on the patient, sir, if the patient is a child, so around 10% of the body percentage we can harvest from the scalp as such. If the patient is an adult, it is lesser. But in an adult, if the patient is thin and the thighs are thin, the donor is quite thin, still the size remains the same. So, about 5 to 6% you can take.
We have been using for children,
Yes, sir.
and it gives a very good result.
Yes, sir.
No doubt about it. But in adults, we have no experience. In fact, there are other skin substitutes which you can use other than taking 5-6% of only from this Scalp.
Yes, sir. But using a double we can increase up to 18%. 5 becomes 18.
And you have done bracing of the graft.
Yes, sir.
Can there be a different method rather than doing a bracing only?
Today I came across one thing, sir. One of the stall had a different technique. I forgot the name. Where we can expand 1:9. We can make
One has to make
yeah.
you can get strong grafts. So
Yes, sir.
many other things can be also made out.
Yes,
But
sir.
only thing in adults I have a little doubt how much it will be beneficial getting only 5 to 6% of the graft.
Yes, sir. If the patient doesn't want his
And we have a options also.
Yes.
We can have a skin substitute.
Yes, sir.
There are so many substitutes that come now.
Since I'm in a government college, I don't think patients can afford a substitute.
So that is not a substitute. Your affording is not a substitute.
Yes, sir.
But it is.
Anyway, you have other options also.
Yes, yes, definitely we have.
Any questions? Yeah.
Excellent results you showed, but would you consider taking the scalp as a donor site if you did not have collagen in your kitty?
Yes, yes. Why not a simple normal dressing is what we do for
Because even if there is a very little amount of scar on the scalp, it will lead to alopecia and future excesses of the patient.
Yes, yes.
No. Only yes. Strictly yes. You don't cause other questions.
Thank you.
Some people will have feel and tendency that it's a risky one.
Yes, sir.
Can you take repeat
So we had a patient, sir, who was around 30-year-old by name X, but months. In a span of 2 months, we harvested thrice. Like every 21 days, we kept harvesting. So we harvested thrice for the patient.
Yeah, it is there. Thank you very much. Thank you all speakers.